Welcome, everybody. My name's Ed Davey. No, I am not the leader of the Liberal Democrats, and most likely never will be. But never mind, that's okay. I am, in fact, the Policy and Public Affairs lead at Centre for Mental Health, and I have been leading this work on the Mentally Healthier Councils Network. And this is the second regional launch event that we're having. The first one was in the Northeast. Don't be jealous. It was just like we were testing it out with them first. Then we've perfected it. And here we are in the Northwest now that it's much better than it was in the Northeast. Now, all the regions are equal, obviously, in our estimation. Although we do lots of work in the Northwest, and it's lovely to see lots of colleagues on the call that we have done work with in recent months and years. So in a way, the Northwest is our favourite. Don't tell anybody else. So we've got some fantastic speakers coming up. We've just got an hour, so it's a short, sharp, wonderful thing, and nothing says Christmas more than launching a Mentally Healthier Councils Network, does it? So it's very festive as well. So I am going to advance my slides, if I am able to. I'm so used to Teams, I'm not really used to Zoom. That's my excuse anyway. So as I say, I work for Centre for Mental Health, which, as I'm sure you're aware, is one of the UK's leading mental health research charities. We've been supporting mental health equality through research, policy development, and campaigns for more than 3 decades. And we are commissioned by local and regional authorities, including lots in the Northwest, the NHS and others, to evaluate research and co-produce. And one of our most significant recent bits of work, if I say so myself, was a Mentally Healthier Nation, which is us leading lots of other mental health organisations in producing a blueprint for a 10-year cross-government plan. I'm sure Bethan will post the link to that in the chat. There's lots in there for local government, and we'd love you to help lobby any political party connections you might have in the lead up to the general election, so that we can get that adopted by whatever government we have. Probably next year. So this stuff you'll all be very familiar with, because lots of you obviously work in public health, but thought it might be worth just mentioning something about the risk and protective factors for mental health. The protective factors there you can see are secure and sufficient income, being treated fairly, positive experience of being parented or cared for as a child, positive experience of school, secure and decent housing, access to healthy natural environments, exercise, healthy diet, abstinence from smoking and substances, community connectivity and relationships. And I won't read all the risk factors, but they're basically the opposite of the protective factors, as you can see. And the interesting thing about looking at those risk and protective factors, I think, is that not loads of them have that much to do with traditional NHS services, clinical care, but lots of them, all of them really, have a lot to do with local government. And that kind of explains our interest in supporting local government to do as well as it can do around mental health, because really everything that local government does, from being often one of the biggest social landlords to being the custodian of parks and leisure centres and having things to do with education and childcare and children's social care and adult social care and all the rest of it, are things in the local government remit. And that's why we're so interested in working with local government and supporting you guys to carry out those duties as effectively as we can. So that partially answers the question on this next slide, but anyway, I'll repeat myself because repetition is key to good political communication, so they say. So obviously in local government, you're responsible for public health, including mental illness prevention, well-being, substance use prevention and treatment, and health visiting, among other things that are relevant. Local government, obviously, a key part of integrated care systems and the host of health and wellbeing boards and your health watch. Vulnerable and adult children's social care and safeguarding is in local government. Alcohol and gambling licensing. You're the planning authority for housing, transport and green spaces. A social landlord, the provider of parks, community centres, libraries and advice. often the biggest employer and economic actor, or at least one of them in your neighbourhood, and a role in education. There's a little diagram there from my 15-year-old daughter to illustrate the perfectly mentally healthier place. So what have we at Centre for Mental Health got to do with councils? Well, over a decade ago, we started the Mental Health Local Government Challenge, and we recruited more than 100 councillor champions. I was actually, when I was a councillor, I was the second ever councillor champion, so I've got quite a history with this sort of scheme and this organisation. And we've been producing mentally healthy council manifestos for local government elections for the last 2 years, and we'll be refreshing that for this year's council elections and regional elections. And we provide direct services, including to, well, soon to be 7 of the Greater Manchester local authorities. And we coordinate Thrive London councillor mental health champions in London, and we consistently lobby for councils nationally when we get the opportunity. And now we're doing the Mentally Healthier Councils Network. So just, I'll mention some of the work we've done in GM. That's included complex system mapping in Trafford. And we've got Councillor Joe Harding from that authority. It was actually Trafford's idea for us to do complex system mapping. We've never tried it before, but it's been really interesting to have done that. And then on the back of the mapping exercise we did with local stakeholders, we came up with an action plan that I'm sure Joe will tell us that they're delivering in full and more in Trafford. We on the right, you can see a report we helped write with Bolton, where we summarised the evidence and the outcomes from a survey they did of their local population and a workshop. And then up the top left there, you can see one of our workshops in Wigan. And below that, an example of some of Wigan's complex system mapping that we've also done with Berry. And we've done a bunch of workshops with our public health colleagues in Stockport. And we're going to be working with Rochdale and Manchester itself in the coming months. So lots of interesting work in the Northwest, obviously clustered around the Greater Manchester area, because that's where we've been commissioned, but always happy to work anywhere else if anyone's interested in getting in touch with us. So the Mentally Healthier Councils Network, which is what we're here to discuss, not me give you an advert for all the other things that we do. It's funded by the Health Foundation very generously, who do lots of interesting work, and they're a kind of charitable trust foundation. And they were interested in supporting our work with local government. The network itself is absolutely free to join, open to all elected councillors and council officers with any responsibility. We're particularly interested in working with public mental health officers, but everybody has something to do with mental health. So we're very happy to have anybody who's interested. We want to recruit hundreds. I think we're approaching about 200. If everyone here today gets us another 5, we'll be well on our way to getting further. And the idea is that we share information, best practice, and networking opportunities. Bethan, my colleague, who I'm very grateful for on this call, puts together a great monthly newsletter and other information. So if you have anything to share, do let us know. I'm sure the contact information will be in the chat, and we will share that with the network. And this is the second of 9 regional events over the next year. And we're interested in putting together a kind of document of something like 100 mentally healthier council policies to showcase best practice across the country. So if you have some policy or something that you're doing, it doesn't have to be directly to do with mental health. It could be one of the factors that influences mental health, like poverty reduction or improving the physical environment, or supporting children and young people to have the best start in life. Anything like that and more we would be interested in. And in the second year, we're thinking of creating some kind of accreditation scheme where we recognise councils who are doing great things around mental health in the broadest sense. So how can you help? Please do promote the network at any events or meetings, or in your local council's electronic newsletters to staff and members. There's plenty of information available on our website. I'm sure Bethan will post the links in the chat, and get them sign up. using the link. It takes seconds. And as I say, if you come across any relevant local government mental health news, please let us know. I'm sure Bethan will put her email in the chat, and we will share that across the country. And as I say, we can provide a range of really useful services to councils, from mental health strategy development, joint strategic needs assessments, complex system mapping, co-production, and lots of other things. So do get in touch if there's something that we can help you with in your area. And I believe that's the last slide. Oh no, yes, as I say, do tell us your good practice. And I've put on there an example from the Northwest. This was some research done on community wealth building in Preston in Lancashire, and an evaluation was done that was published in Lancet Public Health about 6 months ago. And it found that there was a decrease in antidepressant prescriptions and an increase in life satisfaction scores amongst the people, residents in Preston, which was associated with their effort to spend more of the anchor institution money in Preston and Lancashire more broadly, which has created lots more high quality jobs for local people, which, surprise, surprise, has improved their mental health and well-being. So those are the kinds of interventions that we love to hear about, and are so interesting because they take a much broader approach to mental health rather than just thinking of it in terms of hospital beds and prescriptions for pills, as important as those things can be. So do let us know if you've got great examples, and I'm sure we'll hear more today from our speakers. Speaking of which, I am delighted to welcome the first of our 3 speakers, Councillor Joe Harding, who's the Executive Member of Finance, Change and Governance in Trafford, one of the boroughs that we have been working with. And I've known Joe for a number of years now, and I know her to be a fantastic champion for mental health and a fearless advocate for all kinds of brilliant things, even when brickbats are thrown, Joe, on what we now have to call X and other places, because you and I have never been known to not cross the road to get in a fight if we can possibly help it, because someone's got to do it. So with that, I'll hand over to Joe, who I'm sure has amazing things to say. And one thing, I know sometimes people say turn off your cameras because bandwidth or something. But for me personally, I like to see people's faces. Otherwise, I think I'm putting them to sleep, and they've gone off and done something more interesting. But so if you can put your camera on, I like to see a few faces when I'm speaking. But if you can't, don't worry about it. Joe.
Thanks, Ed. Thank you. And I'm muted.
You did, and now you. Oh, sorry, I did that. I beg your pardon. I didn't mean to.
It said the host has muted me.
I meant to mute myself. Now, on you go. Sorry.
Okay, thanks, Ed. Thanks for that introduction. And like as Ed said, really, I'm also one of the mental health champions for Trafford. I'm delighted to be involved in something that's so worthwhile. And yes, we have a Trafford action plan, but I'm sure, like lots of other councils and councillors, we're facing significant challenges. And unfortunately, I can't stay for the whole of the session because I've got to rush off to a finance meeting. It's all of the fun at Christmas, at a time when the local government settlement had just landed and we're looking at budgets and so on. But one of the things I did want to speak about as part of the mentally healthier councils really is the role of councillors. Because if you don't have mentally healthy councillors keeping the show on the road and doing what they do, then you face a bit of a problem really. So I wanted to shine a bit of a light. I don't have a snazzy PowerPoint presentation here. I've just got a few personal anecdotes, a couple of statistics, and just a bit of a story really, and a reach out to councillors across the Northwest to kind of let them know that they're not alone really in some of this, and also to think about some of the strategies that they can employ to keep themselves mentally well really. So there's roughly about 20,000 councillors in the UK, and it's 54% of councillors have admitted that they've seen some kind of abuse. 8 out of 10 councillors have reported different types of abuse. Now, we haven't, thankfully, touch wood, we haven't seen a significantly awful incident that's happened in local government, and we don't want that to happen. We've all seen those cases, those national politicians, very sadly, that have ended tragically. And I don't want to terrify people from standing to be a councillor, because it's one of the most worthwhile things that I've ever done. It's a brilliantly rewarding role. But there is something about the role. And I think if I speak to other fellow councillors, and I know Ed, you being one of them, if we were to answer truthfully, were we prepared for what the role is, then the chances are no, we weren't and aren't. There is no job description that comes with being a councillor, and you end up standing and saying, oh, you'll be a candidate. And in my case, it was thought that I wouldn't win, but I did. And then it was like, oh, what have I done now? And here I am 12 years down the line, having had a variety of roles. And like I say, I absolutely love it. However, it comes with its challenges. There is no job description for a councillor, and we find ourselves being very much a jack of all trades and a master of none. Now, my background is actually health and social care. I managed drug and alcohol teams before I was a councillor, and I also managed mental health crisis services. So I have a background of dealing with people with a variety of complexities. And I had a job description. I went for an interview. There was a person's specification. I went for the interview. That was it. I had my induction. I went along. I have to say, nothing like that happened really as a councillor. We do have an induction, but it's more or less you just have to hit the ground running. And I've been an opposition councillor. I've been a scrutiny councillor, a chair of scrutiny. And over the last 4 years, I've held a variety of cabinet roles: adult social care, culture, leisure, and now finance and change. All of them really challenging. But a thing that is happening now, and I don't know whether it's connected to a post-COVID world, but society seems very different. Ed referred to X, which will forever be Twitter in my world. But certainly social media, there's a lot more anger, there's a lot more rage. And councillors definitely use social media as a tool for engagement, really. You know, we do connect, we do bits of casework, we pick up casework, we engage in different political campaigns. But in some ways, it has become a little bit like open season. And there's something about how we manage to look after ourselves when we're trying to fulfil our role. The other thing about the councillor role is it doesn't really have much by way of boundaries. So I certainly don't have a 9-to-5 job. Very often, I might start work at 9, I'll have meetings throughout the day. And for those of us that have council meetings in the evening, we can very often be there at a council meeting till 9, 10 o'clock at night. And as much as there are many myths out there about the level of financial, you know, the wages or salary that we get, we don't. We get an allowance. And I earned a lot more money when I was managing drug and alcohol teams. You know, but like I say, it's a hugely privileged role, but I work full time as well as having a full time cabinet role. So I guess it's just a bit about putting it out there that how do we as councillors put those boundaries in? How do we recognise what's happening really? I think the first thing to say is that you're not there to be abused. You should really adopt a zero tolerance to any kind of abuse and grief that you get, and building up those networks. So if you are starting to have grief, and there are a variety of ways that residents, or not even residents sometimes, just the public in general, that your emails are public. Very often your phone numbers are public. So you're a public servant, you're very often seen as public property, and your information is out there and you're easily contactable. The other thing with councillors versus MPs really is that we don't have those same levels of protection. You know, MPs work in the Palace of Westminster, there's quite a lot of security around them. We're bobbing about here, there and everywhere in our communities because we get involved in things. We're litter picking, we're at parks. I was playing an elf in Santa's Grotto on Saturday. So we're there and we promote what we do because councillors tell a story to our residents. We tell a story about the difference that we're making in our communities. So we're accessible, we're there and we are out there really. But there is something about some of those strategies that we need to employ, and having been on the receiving end of some quite serious threats of late, I now have 3 injunctions out against 3 men, and one of them called at my door, you know, just actually turned up at my address. Another one was on the phone, and you know, it's a bit about how you safeguard yourself. So I want to link you in with a campaign called it's the LGA are running the Debate Not Hate campaign. So if you go on the LGA's website, they have a brilliant toolkit for councillors and councils. So it's definitely worthwhile having a look at that. And the LGA are doing a significant piece of work and taking some evidence as well from councillors. So I just attended a webinar last week, and I'm very happy to share the slides. I will put those links out to Ed, and he can share them. A really useful booklet that gives you some strategies that if you are doing surgeries, make sure that people know where you are, that you have a companion, etc. Don't do home visits. Make sure people know where you are. If you do have home callers, it gives you an update on how you can keep yourself safe. Not having your phone in the hand, mapping out your journeys on public transport and taxis. I don't want to terrify people. It's about perception of crime sometimes. And it's, you know, I would say as a female councillor, misogyny is out there writ large sometimes. It does feel a bit like open season, but you do have to think about your hinterland as a councillor. I guess this is the top tip I'm going to leave you with, because I can see it's 16:24 and I'm on till 16:25. It's a little bit about what's your hinterland. Politics can take over our life. As I've said, there aren't boundaries. It's not 9 to 5. It becomes all-consuming. What do you do to switch off? You must make sure that you do switch off, and you've got to make sure you take responsibility for that. So Ed had mentioned things about exercise, fresh air. I like to run. You know, it's easy, I guess, for people to come home and say, that was a stressful day, let's have a big glass of wine. It's about keeping a check on what your habits are, what you do, and who your networks are. So have a network that's outside of politics. Think of those things that you do that you switch off from just reading council papers. Read for joy. Just do things separately, really. I think the key thing is to make sure that you share if you are getting abused. Don't just tolerate it. We're not there to tolerate that. We're there to be public servants. It's there to be enjoyed, but it's about keeping yourself safe. So if we have safe and mentally well councillors, I hope that means we influence mentally healthy communities and councils as we help to shape the policies that make sure we keep our communities well. And I hope that was just a whistle-stop tour of something from a councillor's point of view. So thanks, Ed.
Thanks so much, Jo, for that brilliant insight into some of the challenges faced by councillors. And you're absolutely right that it is it's a role I did for 12 years, and it's very rewarding and a privilege to do it. But you are out there sometimes getting some abuse and horrible stuff. But I've got to say, as a male councillor, I know I got less than female councillors online and in real life, and also less than people of colour and councillors of different racialised communities. So unfortunately, the kind of prejudice that exists in our society is kind of almost amplified when people are in the public eye and put themselves out there. Nonetheless, as you say, Jo, it is a massively rewarding role. Wouldn't want to put anyone off. There is support available, but we should all do much more to counter the unacceptable levels of kind of abuse and hatred in our public life. And Jo's written a blog for us that we will be sharing in the coming weeks. And this network is a place where we can share insights and tips and support for elected members and officers and everyone else to support ourselves. As Jo says, we can't really expect to have mentally healthier councils and communities if those working in them in elected member roles and as officers aren't supported with their own health and safety and well-being as well. So that was a really useful insight. Thank you, Jo. And I posted in the chat the report we did with Trafford Council and other colleagues in Trafford around the complex system mapping exercise, which that was their idea in the first place. So great things in Trafford. Thanks a lot, Joe. I think you can't stay to the end because you've got other things to do, but we are really grateful for your input. If you do have questions for the panel, who those of us who are there at the time, obviously, but we can always field things to Joe if there's something specific to her by email. Do post them in the chat or have a think and then put your hand up when the time comes. If anything strikes you as worth asking a question about or making a comment about. So do think about that as we have our speakers. And I will now introduce the next one, who I also know. Bye, Joe. Happy Christmas to you.
Bye.
Another Northwest person I know personally and saw recently at, what was it, the Municipal Journal Awards, Charles, was it, in London? Very fancy. We don't normally go to posh lunches like that, do we? But we got invited by the Health Foundation, so that was very nice. Great to see you, Charles. Thanks so much for speaking with us. Charles is the Chief Executive of the Caribbean and African Health Network, based in Greater Manchester, and doing fantastic work relevant to the agenda we've got today. So I'll hand over to Charles. I'll try not to mute Charles. I'll mute myself, not Charles. Unlike, I'll work it out eventually. Over to you, Charles. Thank you.
Yeah, good afternoon, colleagues, and massive thanks to Ed and colleagues for the opportunity to be able to share a bit from our work with yourselves. Apologies, I've got a cold, so yeah, just forgive me. But yes, I'll be speaking briefly about the Caribbean African Health Network, but more importantly, our work that we do with our community and some of the challenges when it comes to mental health and well-being. So for those who don't know about the organization, we're set up in 2017 on the back of our chair, Dr. Faye Ruddock's PhD, that was looking at poorer, why Black people tend to have poorer CVD outcomes. And the more she ran her focus groups, the more people were asking what was going to happen with the data. And lo and behold, 10 people came together, set up a CIC. So we've been trying to shine a light on health inequalities. You can see the vision there to really eradicate or end health inequalities and wider disparities for Black people within a generation. And the mission is ensuring that strategic work, frontline work, all leads to sort of racial and social justice for, people in our community. Objectives is all about collaboration, building partnerships, engaging in continuous consultation, and then doing our very best to champion the assets within our community. So sort of why we're set up: lack of equitable access to services, lack of trust, which we also saw during the pandemic, and then the poor engagement when it comes to the community. And then there are specific health condition areas where there's inadequate knowledge because it pretty much affects our community. But more recently, for example, sickle cell is receiving national attention that for decades it never had. But in the last 2 years, things have changed. And then how do we really tackle the bias? And we're referring to structural, systemic sort of racism. And it's not pointing fingers at individuals, but looking at those sort of structures and those systems that, by default excludes our community. So whether it's decision-making, representation, then, it's something we want to ensure the voice of our community is heard. And how we ensure service providers and policies are not just benchmarked to majority population, but really taking into consideration the diversity within our demographics. So our areas of work, we are a health and well-being organization. And so we do run a number of frontline services, including a mental health provision that we stood up during the pandemic. And it continues to, see an increase in demand. Hence, sure, it's kind invitation. But then also how we empower the community, how we advocate for those that are vulnerable are quite critical. And you can see the 6 health priority areas: mental and emotional health is, one of the 6. And what we know is the data has been around for a long time, whether it's around, Black men, young men, more likely to be sectioned, whether it's about, medicalization and, how people are treated in acute setting, then, we've seen the data for a long time. So when the pandemic struck, for us as an organization, we said, COVID wasn't telling us anything new. It was giving us the seats around some of those tables to have discussions. Like I'd mentioned, we kicked off our work in Greater Manchester, but delighted to be working across the country at the moment. And obviously during the pandemic and the vaccination rollout, there were specific sort of local authorities that we worked with to reach their Caribbean and African community. Our health and well-being provision is anchored by 3 pillars. How do we improve the health literacy of our community so people can do for themselves what they can? So all the stuff around self-care, self-management, for us, that's very, very important, because we know budgets are tight. We know we cannot rely fully on public services. So how do we ensure people can take a lead in that? Then the other bit that is also really important is making sure they are culturally appropriate community services, and our mental health provision is one of it. Yeah, making sure that our community is not labeled hard to reach, but we can test things out. So for example, during the pandemic, when we set up our mental health provision, originally it was going to focus on bereavement support, but then, quickly started dealing with sort of low level, mental illness. And one of the things we knew, for example, the mainstream Greater Manchester Bereavement Hub that was set up, people from our community were not accessing those services. But when we set up ours, brought together sort of 6 BACP accredited, counselors, and the word started spreading out. And we were very clear right from the outset that the services will be accessible 7 days a week. It started getting the word out there, and we started seeing the numbers, and we're supporting hundreds. And then the final bit is how we ensure that the conversations and the health literacy work, plus the services we run, how do we glean, insights that influences, public health policy? Those are very, very critical. So yes, I'm not going to go through this, but we always ensuring that what is happening at national level, as well as local, regional, we sort of plugged in. So whether the core 20+5 framework, testing things out on CVD, the trainer model, and sort of physical activity, the whole sort of green and arts. How do we ensure that African Caribbean arts and culture sort of becomes part of the therapeutic support that people get? Then all those things are quite crucial to us. So yeah, we've been grateful to have worked with system partners and piloted things like hospital discharge, but also, green and arts wellbeing service that seems to be gaining traction with 2 health and wellbeing hubs, one in Bolton, Stockport. We're having discussions, in the city of Manchester and a couple of other places. And yeah, just to whiz on, there's a visit to one of the hubs in Stockport. And we privileged that the chief exec for the ICB came along. But also we do try and capture data. Data is king. So you can see from the referrals we're getting this sort of as of March 2020. But you can see, although the service is focused on Caribbean African people, we don't exclude anyone. So mixed race, you can see white, British, Asian Indians, you can see other ethnicities, Arab, it's just anyone who feels they can benefit from the service, and even breaking down to sort of age ranges as well. Yeah, so you can see an upward trajectory, but then also looking at people's religious beliefs, because it's all part of the person-centered approach. So there could be people who access the service and at the beginning, they want a prayer to be said. And if that is what will mean that they continue to attend the subsequent sessions, then that's brilliant. So sort of whizzing through, one of the key things we've done as an organization is running sort of Saturday morning webinars. And we started since the 2nd of May, 2020. Every Saturday, 50 weeks in the year, we have a break over Christmas and New Year. We have a Caribbean African sort of doctor or consultant that presents to the community, and we make sure mental health is a key part of that. Because when I come to some of the barriers, you would realize, why it's really important to have these sessions. So once again, some of the data we've collated that talks to it. So I'm going to try and wrap up with some of the challenges we come across. So whilst, you know, all communities, and we know people do need help, but also there are services set up for everyone. I think for some of the ethnic minority communities, including the Caribbean African community, there's still stigma around mental health. And so therefore, how we ensure that we getting people to really understand those services are set up for them, but then internally within the organization and externally sort of challenging that stigma is really, really important. The other barrier is about trust, and around that is where people think, you know, services are not set up for them, or they wouldn't really, you know, make any difference, you know, based on their needs, or no one is really going to listen to them. The language, you know, barrier continues to be a big thing, and we're not just talking about translation and interpreting. But then if someone is for many, many years, anxiety doesn't have an equivalent word, or depression isn't what they used to, and there are no, you know, terminologies for that in their mother tongue, then it becomes really, you know, difficult if they are accessing mainstream services and those are the keywords they hear it. And I think there are sections of our community that feel, you know, there is a plan to sort of medicalize, or, you know, get them to become dependent on medication. So therefore, some do, you know, really shy away from that. So will not touch any antidepressants, you know, even if it's prescribed. And then the final thing, which, you know, unfortunately has been in the mainstream media for a long, long time, it's all around immigration. And no one really, you know, tries to, you know, delve deep and understand that impact when it comes to, you know, people and them accessing services. So whilst our wonderful NHS is very diverse with people from over 180 countries, sometimes the unfortunate narrative in the mainstream media that we are rather creaking public services and not propping it up, you know, it's not really helpful. But we know, for example, I mean, the arrival of Windrush 75 years, 2 weeks before the NHS were funded, you know, was started. People arrived from the Caribbean to help build our wonderful NHS. So how we ensure that the narrative is not owned by media and just stopping the boats, but really taking that holistic approach is very crucial. So I'll leave it there, and happy to take any questions at the end. Thank you.
But thanks so much, Charles. Really inspiring as always. And it's so important to have the voices from communities who are really disproportionately poorly served traditionally because of structural racism. And I remember when I was a councillor over 10 years ago, and community advocates like yourself came to me because it was a coroner's report into the death of a young man called Sean Rigg, who was killed by police having suffered a kind of mental health episode, and he was restrained inappropriately. And these community activists, and obviously Lambeth, where I was a representative, has a very large Black community, and I was shocked by the figures showing that our Black community was about 25% of the general population, but 70% of Lambeth residents in secure mental health settings were Black residents, and there's no biological reason for that. There's no those kind of numbers, you know, the disproportionality and the acuity and the prevalence doesn't exist in Black majority countries. It's only for Black people in white majority countries like ours because of racism, not because of biology or anything. And I never knew that before, and it was only because of people like yourself advocating and educating people like me. And then I used what little power I had to try to make a difference. And we did a Black mental health commission with the local community and did make significant improvements. So I salute your work and those are people like you. And it's great to highlight that. And local government has a crucial role to play with communities they represent, especially those who have poorer outcomes through no fault of their own. And we all have equalities duties under the Equalities Act to make sure that we're serving all communities fairly and appropriately. So thank you for that, Charles. Really useful. Moving swiftly on, because we only had an hour and we're running out of time, mainly because I'm waffling on too much. We go to Ruth du Plessis, who is the Director of Public Health in St Helens. We're now crossing the Pennines, virtually speaking and literally speaking, to go to Ruth to hear from the kind of officer. We've had an elected member, we've had someone from the voluntary and community sector, and now into officer territory. Over to you, Ruth. Thank you.
Yeah, thank you, Ed, and thank you for the opportunity. I think Hannah's going to put up my slides in a moment. So just to say that I'm the Director of Public Health for St Helens, but also across Cheshire and Merseyside, I have the lead for public health on mental health and suicide prevention as well. So next slide, please, Hannah. So I think, Ed, you went over this, I won't, but really it was just to point out that biology is a small factor in mental health, and it's actually all the other things, poverty, relationships, self-esteem, trauma, all of those things that affect our mental health much more. And just 2 quotes on here again from kind of Mental Health Foundation and others, just talking about we all have mental health. So that's why we really need to focus on it. But not all of us have good mental health, and this is our opportunity to do this. And I think the need to focus on mental health has never been more important than now. And what we also know is that actually we can do something about it, that actually a lot of mental health, poor mental health can be prevented, so we can make a difference. Next slide, please. I just wanted to focus just to mention as well, sadly, I look at the suicide data, and we're doing a lot of work to try and prevent suicides across Cheshire and Merseyside. And the risk factors are fairly similar as well. Substance misuse is something that I know we haven't talked about as much, but I know it was mentioned before, but that's something we see a lot of. And I think when you're feeling rubbish, you're more likely to try and self-medicate and other things as well. Relationship problems, chronic pain, and I know Charles talked very strongly really about the stigma and the barriers. And what we found in our data, they can be summed up as when people feel trapped, i.e. they're in circumstances they don't think they can get out of, and they feel that they're worthless, that they're not good enough, and those kind of thoughts. And they're the ones that we really have to tackle and really need to be focusing on giving people hope. And a lot of our work is thinking around how we give people hope and the tools to get out of those difficult circumstances. Next slide, please. So I just wanted to mention as well, we're talking about general health, but again, thinking about workplace. And kind of this is some of the data on burnout. This is Mashlak's burnout inventory. And this just kind of thinks about us as employers as well. Exhaustion is one of the key symptoms of burnout, and probably one of the first ones. And we'll recognise that, but also sometimes people don't pick up on the exhaustion in the sense of you putting so much effort into your work that your work-life balance is suffering, so that you've got exhaustion in that sense as well, so that when you spend time with your friends or family, you're too tired or don't have the energy to do things. Another symptom of burnout is kind of cynicism, when you kind of become numb to what's happening around you, feeling like it's indifferent, or you kind of think there's no point, why get your hopes up? And again, that's one of the things we need to be looking out as employers. And inefficiency as well, and this is sad, isn't it, when somebody in the team feels as if perhaps they're not functioning as well, then maybe they're not good enough, or other members of the team unfortunately compound that in some way. And so as employers, these are the things I think we really need to be keeping an eye out for and looking out for. Next slide, please. So I've kind of divided local government actions into 2, if that makes sense. So I think we talked about this, Ed talked really clearly, and Charles, around kind of the populations we serve. One of the structures that we've used in St Helens and also across Cheshire and Merseyside to do this is the mental health concordat. And that recommends that you understand your needs. So we've done a joint strategic needs assessment on mental health, that we work together. So we've managed to get it as a priority across both the NHS and local government. So it's a priority for the Health and Wellbeing Board and for the integrated care system. And then through that, we were able to get action lots of different things. So some examples that we've done is we've got something across Cheshire Merseyside called Kind to Your Mind, which is kind of loads of self-help resources. We've done lots of focus on men's health. We do conferences, we've done events focusing on well-being and talking about good life, because people talk so much about wanting to think about what's positive, and so often in public health, sadly, we talk about the needs, not just about what's great. And then we've got kind of our measuring outcomes. So for us, some of the outcomes we've been focusing on are self-harm reduction and suicide prevention. And again, along with that, really focusing on leadership. And it was great for Joe talking about having a counsellor lead. And we found having counsellor champions has been really powerful in terms of keeping this on the agenda, setting the direction. And again, just in terms of supporting mental health of our employees as well, we found that really as important as a council. And again, we've done things about just normalising the fact that it's okay to not be okay, normalising the fact that it's okay to ask for help and say that you're struggling. And some of the practical things that we alluded to before, that we need to be talking about the causes of the causes. And if wages aren't high enough and that's causing stress, then we need to be focusing on things like wages and flexible working and other things. And we've also got mental health first aiders, which we found really helpful, and social prescribing to help people get into the systems and know what's available. Next slide, please. So this is just as a reminder, these are some of our evidence-based things that we can put in. I think we all know these, the 5 ways to well-being, but this is a reminder that in terms of some of our actions, we focus on this in terms of the workplace and also in terms of what we do across communities around mental well-being. Next slide, please. I just wanted to mention as well, nice recommendations for organisations which are really helpful and have really helpful framework of what you can do as an organisation. But I've put an MB on the bottom of that having those things in place are really helpful, but we also need to make sure that people have got good work and also good pay. Next slide, please. And just to finish on, I know I've spoken fairly quickly, but I was aware of time. I just wanted to say that what we've also found is that having leadership and a focus really does make a difference. This slide here is data on suicides across Cheshire and Merseyside. And what you can see from the blue line at the top is that for quite a number of years, we had much higher levels of suicide, sadly, than nationally. And you can see that when we started to do something around it in around 2015, we immediately began to narrow the gap. And actually, prior to the pandemic, we were bucking the trend, and we were seeing a reduction, where across England there was an increase. So I just wanted to highlight that perhaps these things like this indicates that we can do something about it, and when we do work together and we focused, we can really make a difference. Thank you.
Thanks so much, Ruth. That's fantastic, and yeah, love to see some data that shows that your actions appear to have made a difference and works against the national trend to save lives. And it makes me think, you referred a couple of times to people having enough money, and I remember seeing a study from the US that shows a relationship for every $1 increase in a state's minimum wage, you get nearly a 5% reduction in the suicide rate, which is an incredible correlation. Because and it's also commonsensical, isn't it? If people have got enough money to afford to live a more comfortable life and not be worried all the time about feeding their kids and heating their homes, they're going to be less stressed out and less distressed, which can lead to horrible outcomes, including suicide. So that's what's so interesting about working with local government and others, is it's not just a clinical response, as important as that is. It's about helping create an environment in which people have a chance to flourish and their children have a chance to grow up healthily and enjoy a good life, and suffer less distress, which can lead to worse mental health outcomes. So great examples there, and as I say, really fantastic range from an elected member to the voluntary and community sector, working principally with racialised communities, and then a senior public health officer on the other side of the pennant, showing how we can all work together. And that really is the quality of local government, is that it brings together all these people who have different roles but can work together to improve outcomes with residents. So there is a few minutes left for a very few concise questions. If anybody has any, do put your hand up electronically, or put something in the chat if you want to. It may be that you're all too full of mince pies and your Christmas lunch with your colleagues or something, and it's the end of the day and we're getting near to the holidays. So if people don't, I can understand it, but we've still got a couple of minutes to enable that if you want to. But in the meantime, I will fill the dead air, because that's what I do, with thanking everybody. Thank you to my colleagues Hannah and Bethan for arranging this meeting, and thank you very much to all our fantastic speakers. And as I say, I can see a number of people who I've worked with and continue to work with in the Northwest, and I know there's some fantastic work going on in the region, and be great to continue doing more of it. As I say, had talks with Rochdale and the City of Manchester, so that would be my 6th and 7th of the 10 Greater Manchester boroughs. So I'm getting through them all, getting to know every corner of that wonderful city region. Love to come across the Pennine sometime, Ruth, and work elsewhere in the region. But
Yeah,
lots of
you're
great.
welcome, Ed. Happy to.
Thank you. Yeah, I'll do that. But loads of great work going on. Well, there doesn't seem to be any pressing questions or comments from everyone else, and that's fine. So I can give you back a couple of minutes from your day. And as I say, thanks so much for everybody for attending, giving up your valuable time. Do share the links, any that you've found useful, and especially the ones to sign up your colleagues to the network. It takes literally seconds, and if you can get it in your elected members and staff electronic newsletters, that'd be really helpful, and then we can share more information. And if you do have great policies of the sort that we heard from Charles and Ruth, your suicide prevention work, you're working with racialized communities, your environmental, housing, poverty reduction measures, doesn't have to be, a counselling service, as fantastic as that is. Do let us know, and we'd love to showcase the work of the Northwest around preventing mental illness and improving mental health and wellbeing with your residents. With that, I will wish you a Merry Christmas if you celebrate such things, and have a great time off, because everybody gets bank holidays whether you do Christmas or not. So thanks very much, and I will hopefully see you all again soon.